Dr. Teresa Magalha, sorry for the pronunciation, National School of Public Health, Nova University, Portugal, to give us her presentation on digital transition in healthcare, present and future.
I'd like to thank the European Network of Podiatry in Higher Education for the invitation in the person of the Professor João Martinian. Thank you it's a pleasure to be here and to incentivize the digital health in podiatry. I'm also a professor at the National Public Health School and also an hospital manager. And with this presentation, I will give you some insights of the digital health challenges in health as a whole, and I expect a little on podiatry. So, and I began by presenting you with this chart that shows the overall growth of data in all domains. The large volume of data grows exponentially and is faster than the ability of organizations to maintain it. In a recent study, one of the main concerns of companies is not being prepared for this rapid evolution of data and the risk of being left behind. And recognizing also that the data is extremely valuable to their organization. So, so the health sector, the health area is no different. And it's been one of the areas that has grown the most in recent years. To get an idea, about 80% of data that is produced are not used, but in two questions here. Is the data that we are collecting too much, or how to get as much potential as possible from this data in the future? In this graphic, you can see the electronic health records that are expected to increase in the next years. And here, the remote monitoring will play an important role in the market value of smart hospitals, with a huge growth in value in the next years. These issues raise challenges on information governance. In healthcare, we manage a lot of information and the volume of data continues to grow, as you saw. In addition, organizations are creating and storing a variety of new types of information, and also that information are subject and vulnerable to a conflict of potential cybersecurity failures because we increasingly depend on systems. So, how we are in terms of digital transformation to overtake those challenges in terms of institutions and also in a national and European basis. So nations broadly follow a similar path to digital maturity, beginning with unstructured data capture and progressing towards connected databases that facilitate advanced analytics. And this evolution requires significant investment and regulatory support to connect the wide range of systems in use. Here, the digital transformation can be defined here as a shifting the system's ability to create value through its use of advanced technology. Here you can see where the different European countries, nations, are standing in terms of digital performance in 4 dimensions: the human capital, connectivity, companies, and public sector. Portugal here is in the 15th place behind the European Union media. But in the healthcare sector, globally, the lower relative scores show how challenging the task is for healthcare and government, but even more in Europe compared to the United States. There is a tremendous gap compared to other industries and a huge opportunity to advance. And we see here, but we also have good experience in Europe with the North countries with high levels of maturity in this IQVIA digital health system maturity scores that were built in 3 pillars: the initiatives, the infrastructure, and also the implementation on digital health. And inside the healthcare industry, you can see that the leading role in the medtech is obvious, and it's curious to see that the pharmaceutical companies on the right, on the left side, that have huge investments, of course, on medicines innovations, stay so behind on this matter of digital transformation, digital health. And the evidence suggests that there are shared teams between countries that have succeeded in creating high digital healthcare systems as a dedicated strategy with a clear vision for digital in the countries. And the vision and also the vision is being built by the World Health Organization on the European region, where the global strategy is, of course, to improve health outcomes for everyone and everywhere by accelerating the development and adoption of digital health solutions to prevent, detect, and respond to epidemics and pandemics, and also to develop infrastructure and applications that enable countries to use health data to promote health and well-being. And of course, also podiatry have a response, also a responsive paper also in this. So what can we expect from the digital health? That we will be challenged in the future with increasingly developed and more connected systems. But the question is, how are we going to use the data so that it contributes to real health outcomes? And digital health can be the engine for digital transformation. And in fact, the use of technologies such as smartphones, wearables, social networks, and internet applications is not only changing the way we communicate, but is also providing innovative ways to monitor our health and well-being, and give us greater access to information. And what is the potential for health organizations? Waste in health organizations is a recurrently spoken topic. According to several studies, about 20% of health spending is wasteful. And here is a huge opportunity to reallocate these wastes in activities that really make the difference. We know that many of the diseases can be prevented and others can be delayed in their appearance. And reducing the burden of the disease is one of the objectives, and in which digital health and better use of data we already have plays a very important role, namely in disease prevention and health promotion. The key here is to create value. Technology has to create this value for professionals, but for patients also. And we have to understand it, and we have to be able to measure it. So when we talk about digital transformation, we talk about this ability to generate value and manage change. And we see the opportunity that Portugal have to reduce the burden of non-communicable disease here with opportunity of 31%. And you can see this graphic also in Europe and all the countries. And here, what are the specialties with the higher potential? Here, we see radiology, pathology, the sports medicine that have to do also with podiatry and surgery. Some of it will be substituted by repetitive components, and also will be depending on technology. And it's expected also that in 5 years, the majority of first interaction visits on primary care will be virtual, as also the continuing of care. And where we are. Here you can see the investment in the world of apps in the last years with a tendency to grow, but stabilizing here in terms of number. We want better but more effective apps, and mainly in areas to control diseases, but also well-being in the pathology areas of mental health, the diabetes and heart. In recent years, also AI, artificial intelligence, has attracted more and more research interest in medicine. Numerous studies have evaluated various aspects in the healthcare system, reporting the progress in AI involvement in the prevention, screening, and treatment of diseases and predictions of the prognosis. Here, a recent study shows how AI can predict better than humans in the cardiology area. But still, AI is a tool to support better decisions. In here, some projects that we have already in place in Portugal. This is the remote monitoring of patients at home hospitalization in a Portuguese hospital. And this is a project with AI on identifying lesions in the skin between the primary care and hospital care. Also, this paper was published by a university hospital here in Lisbon with this team about telemonitoring in chronic heart failure with very good results on mortality versus the traditional care. And it's good to know that we have evidence, we are starting to have evidence on these technologies. And also this, and here we have the food power. We already find products in the market as a device to control health as a whole, and also they fit with scientific evidence in that left-hand side. I found several already papers and evidence on these and on another teams, but this is a path, and you are making your path also in technology. and what providers think. We have done this digital health barometer last year in the perspective of leaders, and participated 23 hospitals and 5 primary care institutions. And we can see that 56% found telehealth as a priority for the institution, and almost all do teleconsultations, and 70% have remote monitoring projects implemented. Low telehealth literacy and lack of motivation and training of professions are founded barriers to telehealth development, and we got to work on this. And 55% consider also, as a facilitator in the adoption of AI, the recognition by health professions of the benefits of integrating AI into their day-to-day. 72% report also that the environment for innovation and digital health investment will improve in the next 12 months. So there is a good environment for developing these projects. What are our 2030 vision? We have we made this book that was released on December 2021, and I highlight this vision point to 2030 on digital transformation in health, mainly provide health institutions with new forms of work, with trained professionals with digital health skills and leadership skills. This will be essential to have digital health projects in place. Our national public health schools portfolio, we have several already papers on this. We have 4 PhD undergoing on this area. We have master thesis and post-graduation thesis also. And we have 2 courses on the digital health. We have a digital health executive course with a post-graduation of 6 months, 120 hours, 30 ACTS. And we also have these basics on digital health with the RIS Academy of AIT Health, a European network that we have made the first edition last year, and we will have a second edition this year. We had on the first edition 120 students for all Europe, and was a very good experience of exchanges on this area. So thank you. I'm available for you.
Thank you very much, Dr. Teresa, for that very interesting talk on e-health and digital transformation in healthcare. I think it is the future, and I hope we will have the opportunity to open a bit the discussion after our talks, but I know we are running a bit late. Now I would like to